Good afternoon, everyone. Thank you for joining the May Congenital Heart Surgery Database webinar. First and foremost, we want to thank you for joining today's call. We hope you, your coworkers, friends, family are all staying safe and healthy during this crazy time. On the call today, we have from the STS myself, Leanne Jones, database manager for the thoracic and congenital heart surgery databases, Carol Crone, Senior Clinical Manager for the STS National Databases, Emily Conrad, STS Senior Database Coordinator, Donna McDonald, Director of Quality, and Jane Hahn, Associate Director of Quality for the STS. We also have our IQVIA colleagues, Melanie Bent and Jeanette Hanna, as well as additional IQVIA team members on the call today as well. For our housekeeping items, I just want to touch bases on 3 topics. The May training manual has been updated and posted. That is available out on the website for your access. Also, we have newly updated, yes again, sorry about that, data collection forms have been posted out on the website for your use. These updated forms as well as the training manual include both of the new COVID-19 variables. So those are out there for your information. And also, for those of you that may not be aware, the STS does have a mentorship program available to assist new data managers. For the mentorship program, the STS pairs experienced data managers with those who are seeking advice related to data abstraction. After filling out, the STS has a questionnaire available, so after filling out a questionnaire, potential mentors and mentees will be matched based on database type, experience in specific areas, as well as other factors. STS, once we get the results of this questionnaire, STS will share contact information with mentors and mentees. You'll be matched up, and STS will facilitate an ongoing mentorship relationship. So if you are interested in being a mentor or a mentee, we just ask that you complete the database mentorship survey found out on the STS website. This survey can be accessed on the STS National Database webpage by clicking on the Data Manager Education link under the Important Resources section. I don't know if Carol or Emily may be able to put the link to that data mentorship survey out in the chat box for everyone to see. That would be helpful.
Sure, Leanne, I'll put it out there for everybody. This is Carol.
Thank you, Carol. Next, I am going to turn things over to Emily Conrad, our STS Senior Database Coordinator for our STS AQO update. Emily?
Hi all, great to speak with you today. I just wanted to provide a little update on AQO. If you have never attended before, AQO stands for the Advances in Quality and Outcomes, a Data Managers Meeting. Typically, we go from city to city, but unfortunately with the climate with COVID-19, we are not able to go to Providence this year, maybe in the future. But we are going to have a virtual meeting this year. I think that it's going to be an opportunity for some really great innovation and creativity with how we have our meeting. So this year, each database will have its own day, ranging from Tuesday, September 29th through Friday, October 2nd. For congenital, the meeting will be on Friday, October 2nd. Right now, as an update, we're looking at platforms to host the meeting with our education team. A platform should be chosen within the next couple weeks. And then once that is done, pricing will be able to be established. So we will inform you all about what the pricing will be, probably through the website or STS National Database News or a standalone email. So be checking all 3 of those as we move forward. As for the functionality, we're hoping to have live stream talks, pre-recorded information, the capability to have a question and answer through both chat boards and panel discussion live, If you're interested in submitting a quality improvement project, our abstract submission should be opening soon. And with that, we'll be having e-posters. So that will be really cool. Also, we're going to have some exhibit time so that you can have vendor engagement as well. So more to come, but I just wanted to give you an update that we are going virtual this year, and we're hoping for the best.
Sounds good. Thank you so much, Emily. I appreciate it.
Yeah.
All righty. Next, we're going to go ahead and just jump in the STS update for the COVID-19 variables. As you're aware, STS has added 2 new fields in order to collect data on the COVID-19 patients. We have activated the use of temporary coded field sequence number 6724, and most recently added the temporary date field sequence number 6723. As you're aware, sequence number 6724 is now being used to answer the question, did the patient have a laboratory confirmed diagnosis of COVID-19? And temporary date field 6723 was added to capture the date of positive PCR testing for COVID-19 closest to the OR date. In terms of abstracting the COVID-19 fields, please note, it must be a positive PCR test. We are not collecting antibody testing, so you're not to capture antibody testing. For more than one positive test, for patients that have more than one positive test, please collect the test closest to the OR date. The testing field begins with April 1 cases, and we are asking that the temporary date field data collection begin with May 1 cases. But obviously, sites do have the ability, you can retroactively collect those fields back to January 1 if you choose to do so. You are not required to do so, but if you choose to go back to January 1, you're more than welcome to go back to January 1 for those cases.
Hey, Leanne, when you say closest, is that before or after?
Yes, correct,
Dr.
Williams. It's closest to the date.
Thank you for that clarification. I appreciate that. And also, as always, before submitting your questions via the clinical question submission form for these COVID-19 variables, we do encourage you to check the training manual to see if your questions have already been answered. We have updated the training manual with several of the FAQs that we have been currently getting for these COVID-19 variables. And abstracting abstracting the COVID-19 fields. We've seen this slide before, but again, I just wanted to include for those that may have not been able to join any of our previous webinars, why was this field added? Obviously, sites have reported that patients who are found to be COVID-19 positive are having worse surgical outcomes. Do we need to go back to January 1? No, you do not have to go back, but if you choose to do that retrospective data collection, you are welcome to do that. Will these patients be included in outcomes? SDS, surgeon leadership is currently discussing how these cases will be handled. We will need to get the data in to see its impact before coming up with a final decision as to how this data will be handled in analysis. Just know that once the STS surgeon leadership does get a final plan in place, this plan will be shared with data managers and other surgeon leaders and participants. So just know that that information will be shared with you as soon as we do have a plan in place for how that data will be handled. Another question that we've gotten is, can I abstract a patient who is assumed to be COVID-19 positive but was not tested? No, we're only coding for patients who have been confirmed to have a COVID-19 positive laboratory PCR test. We are not coding any assumptions. We just want definitely those who have been confirmed to have that COVID-19 test, positive test through laboratory testing. Also, for any patients that self-report positive testing for COVID-19, we ask that for patients that self-report positive for COVID-19 within 30 days of surgery, please indicate yes after discharge within 30 days of surgery for those patients. Next, I will turn things over to Melanie and Jeanette for our IQVIA update. Melanie?
Thanks, Leanne. And hello, everyone. Let's go ahead and talk about things that are happening for the congenital registry. So we did have additional feedback come in, and of course that shifted our launch date, but we're still looking at targeting for next week. But STS will be providing the formal communication around the actual date. Currently, we do have beta testing that is still occurring, and through that testing, it really has been very impactful, and positive feedback in regards to improving the user experience. That really has been a lot of the focus, and just the making sure that the experience is one that is smooth. So based on that feedback, there have been updates to the data quality report. We've had some changes in regards to the layout of the report, and I'm going to point these out once we go through a walkthrough, and I'll show you. And through this feedback, it actually has impacted across all three of the actual databases with some of these changes. So definitely things that we've been able to see as a benefit to the user experience. So with the report layouts, I'll show that on the DQR, and then also there's been some updates in regards to the validation severity levels. Those items were raised and STS reevaluated, and based on that feedback and based on that impact, we were able to go in and make those changes also. Updates to the missing variable report, and then we were able to release the dashboard, and we've had feedback in regards to the dashboard. So again, all positive, and we're able to at least accommodate some of those changes that of course you will be able to see once you log into the application. Let's go ahead and take a look at the next slide. So some things that we wanted to raise that you will see once you log in, and just to at least give you a heads up of feature functionality, is a new implementation of the system recognizing records that have been removed in the source software system. So the use case is, you go into your software vendor system and you realize that there was a record that should not have been added, and you needed to go ahead and remove it. And in this instance, the assumption is you've already uploaded to the IQVIA system, and so that record also is in the IQVIA system. Okay, so they're in both places. So now you realize that record needs to be removed, and you do that within your software vendor system. And once you export with that change and you do an upload to the IQVIA system, we will look at different pieces of the data to determine that the record should also be removed within the IQVIA platform. And what the system uses the minimum and maximum surgery date ranges. It looks at that, and there are also other criteria that it also evaluates. Once it determines that, then it will do a removal within the IQVIA platform. So let's go to the next slide, and I can show you a visual of how that process will work. So again, the assumption is you've already uploaded. So this is, you've currently are working within the system, you've uploaded records, but then you realize that there was a record that you did need to remove within your software vendor system. So this example shows a surgery date of 8/1/2019 through 8/5/2019 as your minimum and maximum dates. And so once you upload that file, it will go through and it will validate if the record already exists in the system. So if you look at the example where it says preload, the preload is the records that are already available. So now we're doing that secondary file submission. And so if you look at record A and go through that process, the system will find record A, and it will proceed with making sure if there's any updates to record A, it does that. If it finds it already, it basically just acknowledges that it's already there. But then you'll notice in the next cells, you have record B and C. Those were removed within the software system, your vendor software system. And so it realizes that those two records are no longer included within that surgery date range. And by further analysis, it basically identifies that those should be removed. And so you see post-load then gives the end result where those are taken out of the IQVIA platform. And then you'll see that there is, we'll skip down to record E. Record E is a new entry, so new case that's been added within your vendor system. It realizes that it did not exist before. You'll see that it will proceed to add record E into the database. So just wanted to show you this new piece of functionality and how this will work once you start updating and loading records within the system. Let's go ahead and go to the next slide, which basically it's just the workflow steps. For those that like to go back and look and see the and review PowerPoints that are posted, I wanted to make sure that if you're not listening to the recording and you're just reviewing the slides, you're able to see the actual steps that were involved with this feature. Okay, so that's what this covers. If you can go to the next slide.
Mhm.
Thanks. And another thing that is new within the system, and you will notice once you start doing your uploads, is that the system now will only execute at the time of upload. It's going to recognize, right, as you're going through the upload process, it's going to recognize whether or not there has been a change to the record or if the record has stayed the same. And in this example, let's just walk through the instance of you're initially going into the system and you're doing your first upload. Within that upload, you have 100 records. And so you will see that the system will process 100 records. And if there are no issues or items that will basically prevent any records from coming in, and let's just say everything is good in regards to the validations, nothing is going to be prevented. 100 records have been accepted into the database out of the 100 that have been submitted. Okay, so your card would show 100/100. Now, that same file you upload, but you have only changes to 10 records in that 100 record set. In this instance, when you upload that file again, it's going to recognize that out of the 100 records, only 10 have been updated. And so in that instance, the upload card is going to display 10 out of 10. It's not going to show you 10 out of 100 out of the total. In this instance, it's only going to give you the total number of what was updated. But once you go into the data quality report, you will see the full number of records that were included in your submission. And I'm going to walk you through where you would see that. Okay, so just want to make sure that that concept, and as we do the walkthrough, you'll see that again, the system is only going to update and display records that have been updated. If there are records that are already in the system, it's going to basically acknowledge that the record had not changed. It's not going to include those in the final count that you're going to see on the card. You will see 10 out of 10. Okay, let's go to the next slide.
Mhm.
And this basically describes that same scenario in regards to what the system is going to display after you've done a secondary upload to let you know that out of the record set, total number that's been updated will show on that card. Another thing that we wanted to introduce to everyone is that we have a new report that is currently in development that's called the Harvest Summary Report. And this report is going to give you a lot more information. And I'm going to hand this over to Jeanette, and she will walk us through the new report concept and being able to give you a better view of your records that are in your database. Okay, Jeanette, here you go.
Thanks, Melanie. This is Jeanette. So as Melanie mentioned, when you do a submission, you will immediately have access to that data quality report off the View Reports link in the Uploader interface. That will be available for you right away. This piece, what we're talking about with the harvest summary report, will be coming in a couple of weeks. And this view will allow you to look not just at what happened with a single submission, though you can look at all of your historic submissions as well in that uploader interface. This is going to give you one place to go to look at, okay, you know, maybe I did a submission last week and another one this week, and maybe my colleague did another one this week too. Let's see what is in the system and is there, and get a summary status of everything that made it into the database, which records had some sort of data validation on them, even though they made it in, they made it through. So this here will show you, for your selected operation date range, a list of all of the records or all of the operations that have got into the system. And that pie chart will show how many of those have an error validation outstanding, which is a higher severity, one that you need to pay a little bit more attention to. And then which records or operations have a warning outstanding. And then how many of them actually have none of those outstanding at all. You know, maybe they came in completely clean and there's nothing that you need to take a look at, no information you need to review. So you'll see that in this record summary view, and then you can take a look in that table to the right with the alerts by submitted record. It'll show you, for the patient ID and operation ID, everything that's there in the database that's eligible for inclusion in the harvest, and how many of those have errors, which you definitely are going to want to take a second look at, and how many of those have warnings, which, you know, we recommend that you take a look at, but they're a little bit less urgent in your review. And to see what those errors or those warnings are, you can make selections in that table on the upper right, and the lists of those errors and warnings will show up in the record level validation section down below. So this is a really great way for you to sort of take a look at the current state of the harvest submission, of what's going to be included in the harvest, based on, you know, the date ranges that you've chosen here. So if you did want to focus, say, on just 1 month's worth of operations versus multiple years, you can do that with changing the filter selections on the left. And if you're focused on operation type 1 and 2, as opposed to the other op types, you've got those filter options on the left as well. Mel, is there anything you want to add?
Sorry, couldn't come off of mute. The other thing that I wanted to share was that this, again, came from feedback from the beta testers. So I do want to give a shout out to the beta testers, because this was something that was a concept that was raised and discussed. So I do want to at least, again, through that feedback that they've been able to provide and all of their diligent testing, really come up with solutions in assisting in making the platform more interactive and just user friendly. So just wanted to throw that out there. But other than that, I think you covered everything with us. Okay, so thank you, Jeanette. Let's go ahead and go through the application. So I'm actually going to go ahead and share my screen, and just give me a moment.
Do you need me to stop sharing, Melanie?
I think I should be able to just start. Let me just click this tab if it'll allow me to. Let's try it again. Yeah, if you can stop sharing, I think that it's not going to allow me to do it if you don't stop. Okay,
I stopped share.
There we go.
There you go.
Okay. And just let me know when you can see my screen.
Yes, ma'am, I can see it.
Perfect. Okay, so I've already logged in. So again, once we have the official launch announcement and communication, you will be receiving, of course, your username and password to access the system. Once you log in, you will be brought immediately to the upload menu. And so this is the interface that you will see upon logging in the first time. And so when you log in, you're going to have two options to actually import your files or upload your files into the system. You can drag and drop, or you can use the option to choose the file from the computer. What I want to do is, and I've already uploaded, so I have some examples down below just to be able to show you what will happen after the upload. And so once you choose either one of those options, I'm just going to show you how the interface changes when you choose either of those options. So just give me one moment where I can just get a file. I have a test file here, and I'll just drag it so you can just see that if you were to do a drag and drop option, you'll see where the interface then updates and says release to upload the file. If you didn't do the drag and drop option, you do have the choose file from computer, and so you're able to navigate to a location on your computer and you can pull in a file in that manner. So I've already uploaded quite a few files. I did one before getting started with the webinar, and I wanted to show you those entries. And so in these examples, I'm also going to talk about that new functionality that I raised earlier today. When you go in and you initially load your records, it is going to basically check to see if those records exist. In this instance, you will see that I had a file set that had 480 records in that file set, and out of the 480, 461 were accepted. So that's how you read this entry. And so what you would want to do is, of course, take a look at other things that show up on the card. And before I even get there, I think I may have covered this, but just to make sure that we're all ready, each entry will have a status option on the left-hand side of the card. It's either going to show up as a green check or it will show up as a red X. So I just want to point that out. In the instance when you see that there's a red X here, that means that the file, the entire file, did not upload. It was a failure. And so when you go into that specific DQR, you will see the status listed in there too as failed. So we can just also, I'll bring that up so you can see and get familiar with what that will display. But immediately when you see that, it will let you know that there was a file failure. So you see that it failed. Okay. In those instances, if you run into the file not uploading at all, that is an instance where you would need to reach out to our support team. So there is a slide that we're going to come to shortly that will basically give you the steps of how to contact our support team. Next, you'll see that there is another type of status, which is basically a success status, where the file uploaded and it was successful. So you would see that green check. And then also you would see that you would have an update here of the processing status, and that basically will say file upload completed, and that's what you want to see. And so in this instance, file has been uploaded successfully, but I hit another type of scenario here where I encountered a critical. So anytime you see a red circle with a white X in the middle, that basically indicates critical message, and errors that encounter a critical message or critical error, that means that the records were not accepted into the database. Okay, so very important to understand that if you were to see this appear on a card, that means that there were records identified as not being accepted. And so the next status that you see here, or next error severity level, is error. So this example, let me just show you what the report is going to display, but you can also see 0 records out of 85 were not accepted. So no records were accepted. So you want to pay attention to that too. So let's take a look in this example. And this is where I may have set up a scenario where the participant ID does not match. Okay, and this is mainly, many of you may not encounter this, but for those who have access to more than 1 participant site, you're abstracting for multiple sites, and you in an instant can grab a file, pull it in, upload it, and then realize after the fact, oh, that was not the correct participant site. Well, the system is going to catch that for you. And so in this instance, that's what happened. There was a file that I pulled in that did not match the participant that I was uploading to. So therefore, it threw it as a critical error message. And so it will show you that on the data quality report. Okay, participant ID does not match. So that is a scenario for this. Coming up a little bit further, let's go ahead and let's take a look at this entry where I had out of 480 records that I submitted, 461 were accepted. And I noticed that I have a couple of icons that appear here. We already talked about the critical, we talked about the error, and now we have another one, which is the blue triangle, and I believe it's a little wrench that's in the middle. That's a warning. So let's take a look at that data quality report. And you can see with this, I have, of course, all of those different validations that have fired. But before coming here, let me just go over the fact that you have some filters that are available. Want to point out that these filters are dynamic. That means that if in the instance my file did not have any critical errors, then the critical error filter would not display. So you would only see the filters that basically are triggered based on the files or the records that are within the system, within that submission rather. Okay, so I do have critical errors. I do have cases that have been flagged as having being op type 1 or op type 2, and then the other are for all other op types. Okay, so you can use these filters to be able to display that those cases on your list. The other thing that you'll see here is the file validation, the file-based issue or file validation level message. This is just confirming that the file passed, it uploaded successfully. And then you'll come into the middle, you'll see that there is a validation alert summary where you have this pie chart. What you can do is, again, click your mouse, you can left click your mouse and hold, and you'll notice that there is a blue shaded box that appears as I do that. Once you let go of your mouse, you'll see that everything is selected, all warnings are selected, and it will populate the alerts by uploaded records. You'll see that each respective severity level is represented as a column, and so you're able to see all of this information in one shot. And not only do you have this information selected, based on all of these items that are selected, the full set of validation messages will appear down in the records level validation section. And the number one question that we always get is, can we export the full list? And you can. If you were to right click on the section, you'll see that there's a menu that's going to appear. Within this menu, you have the option to export to a table, and you'll see there's another option where it says export table without value formatting. This is in instances where you're not using Microsoft Excel, you're using maybe some other spreadsheet type of program, this is what you would use. If you're using Microsoft Excel, you do have an option for Microsoft Excel export, and you're able to then generate that report by using this option. Just want to take one further step in this export, in these export steps. Once you click on that option, you're going to be presented with this menu. And here in this dialog window, I want you to make sure that active page is selected. That's the only option that you would need to select in here. Once you've done that, then you hit export, and that is going to generate your Excel report. Okay, so I'll go ahead and do that. But the other thing that I wanted to point out that came out of the feedback for the from beta testing is being able to see the instead of having the IDs of operation ID and source patient IDs, those used to appear within this message content here. And so within this message content, they were saying that we would like a way to have those stripped out of there, put them in the respective columns because we already have those there, and just give us the message. And so we went ahead and implemented that. You'll notice that those IDs are not here. So when you export, you'll be able to do more effective filtering just on the message. Okay, so just wanted to call out that that is something that came out of the feedback. So let me open up the Excel. Hold on a second. I have many windows open. Okay. And you'll notice that, again, because I had everything highlighted and selected, you'll see that all of the columns related to the validations are showing here. And then you will see all of the details that are available at the bottom section of the report listed on the Details tab. Okay, so you're able to go in and review your Excel. So that is how you are able to export all. Okay, so that is the data quality report. Let's move on to the next report that you will be using once you log in. You would navigate to the operational reports menu and you will have two available reports. I believe the last time we met, we did not have the participant dashboard available. I am in a test environment, so just wanted to call out that now that's been updated and we launched, and our beta testers were able to start reviewing the dashboard. So we'll come to that in a moment. But the missing variable report, once you select that link, you're going to enter in a date range. You can manually enter in a date range, or you can use the date selector that appears when you click in that field. So I'll just do for 2019, I'll go ahead and just do that full year. January through December. And once you put in a date range, you would just select apply parameters and the report will generate those variables for you. You'll see that the information is going to show up on the left-hand side in regards to the parameters that were selected. You do have filters that are available here where you're able to narrow down the list of variables that you're focusing on. We have mortality, anesthesia, and I'm going to come back to anesthesia in a second, and then the risk model filters. For anesthesia, if you are not collecting anesthesia, or if you're not signed a contract with STS to formally collect those, to have those included in the analysis, the anesthesia variables for your site, if you're not opted in, those will not appear on this report. Okay, so just wanted to also let you know that those, if you're not opted in to anesthesia and you select that option, this would actually not appear for you. For those that have opted in, you will be able to see those variables available for your review. So just wanted to call that out. And then you'll notice that you have another filter option here in which you're able to only look at the cases that have been identified as op type 1 or op type 2. Okay, and then the other filter is for all other identified op types. One question that always has come up a couple of times is, how do we export the full report with the results? You'll notice that nothing is selected at the moment, but if you were to just select maybe the first column, first variable column, you'll notice that it brings back the results for that variable. But the question is, well, how do I get all of them to appear down at the bottom, because I want to export that? What you would do is, again, take your mouse, you would left click on the mouse and hold, and you'll see that it starts to do a shading around those cells, like that blue shading, and you just bring it all the way down to the bottom. All I'm doing is dragging my mouse, making sure that it goes all the way to the bottom, and then I let go of the mouse and it highlights all of the cells. Once you see it in this state, this bottom portion of the report will go ahead and fill all of the results that have been selected up above. You will then have that option down here. Again, to export, take the same action of right-clicking and choosing the option to export, or you choose the option for the Microsoft Excel. Okay, just wanted to make sure that you're aware of that. And then also you're able to get to that same menu if you were to use the file menu. You'll see that there's file and export, and you do have the options for table without formatting. Again, for those that are not using Excel, you can use that option, and then you have the option for Microsoft Excel. Okay, so let's also move over to the other report, the dashboard report. So I'll navigate away from here. And this is our operational reports menu. Here is the report for the dashboard. You'll notice here that you'll have, this is what's called our parameters page. You'll have 3 parameters that you will be able to enter. Any parameter that has a red circle next to it means that it's required. And so if I happen to leave these unanswered and I try to select on apply parameters, it will prompt you and let you know that you have to put in the required fields or the required parameters, okay? Time period and age. And so I'll go to time period. You'll have a predefined list of reporting periods, or you can enter in a date range. So I'll just select a time period. For your procedures, you can actually filter your procedures by stat category or by procedures. Another piece of feedback that has come from our beta testers has been in regards to making sure that we are able to filter on index cases. So that is something that we are working on. So at the moment, that is currently not in place. So you don't see that. That is something that we are working on. And so you can go in, you can select, let's just say I'll do all procedures. If you select all, it will deselect the options down below. Okay, so just let you know that it does that automatically. And then I'll go ahead and select my age. If you select the field, it gives you a drop down, and you can go ahead and select one of those options. I'll select all. You do have an option to put in specific days if you'd like, if you don't want to use one of the predefined options that are listed in the age group. Once you've done that, select apply parameters. And here you'll see the analysis, and again, it's the information that has been uploaded into your system up until the current time. This data is not analyzed, it's unanalyzed. We'll be coming to another implementation where we'll be introducing the data that has been analyzed by DCRI, and that will be a different report. All right, so just wanted to let you know that that is something that's in the works and is that will be available as an additional report. So once you've selected your parameters and generated the report, you will have the different report sections that you're able to review. Okay, and in here it is interactive. So once you get in, just know that if you were to select even on the graph, let's just say that you wanted to review the items that have been, or the variable that has been entered in for sex at birth and who responded female, for example. You're able to see, if you click that, it highlights the cell here, and it then updates and will display all of the cases that have been identified as female. So just wanted to show that. And again, if you were to go to the specific section, and let's just say that you wanted to see the cases that have a yes response for Hispanic or Latino, if you select this, it will then display all of the cases that have that selection as yes. So that's basically the concept within the dashboard and that interaction. ways for you to export, similar to what I showed you. If you wanted to export the list that are associated with all of the variables that are within this section, then you're able to highlight just as how I've shown previously, and it will populate the list down below and you can export. Okay. Also, keep in mind, we're still iterating and adding to the dashboard. Changes will continue. We will continue to make changes to the dashboard and have additional updates. When you go in, there may be certain variables that are not currently available with this first implementation, but we're continuing to work with STS to continue to add to the dashboard. Okay, so just understand that once you go in, you may not see a specific variable or section at this time. It's not to say that it's not coming. This is just the first iteration, and we're continuing to work through that. Okay, so I think I took up a lot of time. I hope that this has been very helpful with getting everyone ready for the launch and being able to get into the system and really, dig in and upload those files and take a look at what data you have entered into the platform. So with that, I will stop sharing and I will pass it back over to Leanne.
All right, thanks, Melanie.
You're welcome.
I need to share my screen. Can you see my screen now?
I can.
All right, perfect. All right, thank you, Melanie. That was very helpful. Thank you very much for being so thorough and going through all of that. We greatly appreciate it. All right, so next, the STS IQVIA support plan. We've all seen this before. It's posted out on the STS website as well, and I believe it's also there's a link also available within the platform. But this is the IQVIA support plan. If you have questions, you would call the tech support number here or email tech support. Once you contact IQVIA, you'll be connected directly to Tier 1 IQVIA support. Tier 1 IQVIA support will work with you directly. They'll issue your ticket numbers. If they cannot answer your question, they will route your question either to STS for assistance, or they will route your question directly to Tier 2 IQVIA support. And that's if Tier 1 can't answer the question, they'll route it to Tier 2 support follow-up. If there needs to be any interaction with your database vendor, IQVIA Tier 2 support will follow up, work directly with your vendor. But if it's a question that you know that that you already know it requires your vendor assistance, go ahead and contact your vendor, your software vendor. Tier 2 will work with database vendors for very specific issues dealing with the structure of the data file. But if this is an issue, again, that you know that needs to be corrected by your vendor or can be resolved from your vendor, and Tier 1 has told you, this seems to be a vendor-related issue, then you would need to go ahead and contact your vendor directly. So just wanted to clarify that. If there are questions that STS cannot answer regarding to analytics, the STS would contact DCRI directly for assistance on answering any of the analytic questions. Here is just a listing of the current resources available for your support. As always, please do not hesitate to reach out to me directly with any questions or concerns. Just to run down real quickly, you have the STS National Database, which is full of resources. You have STS Tech Support at IQVIA. You have the phone number for support. And again, you would contact STS Tech Support at IQVIA.com for any issues related to Uploader, data quality report, missing variable report, dashboard, passwords, and logins. Always there is the STS National Database feedback form out on the STS website. We welcome any of your feedback, things we can do to improve. We're always looking to improve. How can we make your experience better? Let us know what we're doing right, things that need to be improved upon. So please just let us know. We'd love to hear back from you. And again, just a listing of additional resource documents that are found out on the STS website. As always, here's my contact information, my direct email, as well as my direct phone. If you have any database operational questions regarding your contracts, payments, your contacts for your site, please email us at stsdb@sts.org. So if you have anyone in your organization that needs access to the platform, again, you would just email us at stsdb@sts.org. And we could help you get that information. Our next congenital webinars, currently right now we have a user group called scheduled for next Friday, the 22nd at 11 a.m. Central, and our next monthly webinar is June 19th at 12 p.m. Central. I wanted to conduct a quick poll to see if this Friday time was good for you all. So I believe I've started the poll. I don't know if Carol, if you guys can see it on the screen. Just let us know if this date and time would work better for you. Just trying to get a feel for if Fridays are good for user group calls or the monthly webinars. We're just trying to get a little bit more information to make sure we have these calls at a useful time for our data managers. So we'd appreciate any of the feedback that you can give. I'll give a couple more seconds. We still got some more responses coming in. So I'll give just a few more seconds to get the rest of these responses in. All right, it looks like we're slowing down. Oh. All righty. So share the results. Looks like for most everyone, this day and time is fine. So that is very helpful. We thank you guys for providing this feedback, and we'll take it back and take everything into consideration when planning future webinars. So thank you guys very much. We appreciate that. All right. So next we're going to just turn things over to open discussion. If you have any questions, please be sure to submit those via the Q&A function. We're going to, I know we've got less than 10 minutes left, so we're going to try and run through these questions real quick. We'll answer as many questions as possible. We do encourage your feedback, so please let us know what you think. And if I'm unable to answer any of these questions, please, or if you have questions after this webinar, please feel free to email me directly. We're happy to help in any way. So we'll just go ahead and start tackling these questions. Our first question is, what about patients who self-report testing pre-op? And that is fine as long as the data manager confirms that it was a PCR testing and not antibody testing. So that is fine as long as you can, again, just confirm that it was a PCR testing that was completed. Our next question is, will we start tracking PMIS, pediatric multisymptom inflammatory syndrome? I have not heard any talk of that, but I am happy to take that to the task force on our next call to bring that up and maybe set that as a suggestion for the next upgrade. So I'm happy to take that back to the task force for consideration. All right, our next question.
Oh, sorry,
Carol.
Leanne, this is Carol. We may already be capturing some of what goes into PMIS to already as preoperative risk as the baby goes into the operating room, but we can definitely bring it back.
Yes, absolutely. Thank you. Our next question from Angie, excuse me. Is there value in waiting until we can validate that our 4-year data file is correct in the new platform before uploading our 7/1/19 through 12/31/2019 cases?
This is Melanie.
Yeah, go ahead, Mel.
Value in waiting. I think that, and Carol and Leanne, you weigh in, but once the application is open, I think you can go ahead and submit and basically start reviewing the feedback that you're getting on that submission as soon as possible. And then that also will get you familiar with how the system is running the validations and what's being presented back to you. So that's kind of what I'm thinking at the moment, but I don't think that it should be pushed out any further. I think as soon as you get the access, get started.
I
Well,
agree.
so you could look
Go
at
ahead.
what's already loaded up right before they submitted any files, because their back data for 2 versions is going to be sitting on the system. So they could use the dashboard to get a feel for what's there. They just won't get the DQRs, right?
That's very true. That's very true. So, so what's being called out there by Dr. Wormuth is, once you get access to the system, we do have data that's been migrated from DCRI for the past 2 versions. And so you would be able to go in and start reviewing the dashboard and also the missing variable report, because it will look at that data set. And then you could go ahead, after reviewing that, then you can go ahead and do an upload of the data. So it would basically give you a before and after look.
Mhm. Good. Thank you, Melanie. Thank you, Dr. Wormuth, for pointing that out. All right, our next question, I think this goes along the same lines. Our data manager is going to be given time to use the software before it goes live. So once we go live, you'll have the opportunity, like Melanie just talked about, Dr. Wormuth, you can see the data that's already in there and get used to, the functionality, but everyone will have access at the same time once we go live with the platform. Our next question, can you show us the view the surgeons will see?
So the surgeons, when they log in, they actually will not have the uploader interface. So when they go in, they will actually have access to the dashboards. So they'll get access to the participant dashboard and also the missing variable. And then, of course, once we roll out the additional reports that will come from the data based on the analyzed data from DCRI, they would have that dashboard. So primarily, it would be once they log in, they would be navigating to the operational reports menu.
Thank you, Melanie. Our next question, will the reason for the validation error be shown in the records level validation panel of this future report? I assume she's talking about the harvest summary report.
This is Jeanette. I can take that one. Yes, so there is a message that shows, which is, it gives you information about what the validation is. And that was also visible when Melanie showed the data quality report, so that you can get an understanding of what was happening in your submission. So you will see some informational wording that will explain what the validation is.
Thank you, Jeanette. And our next question comes from Mari, but it says, if I have 10 errors in my first submission and I fix only 5 of the errors and submit again, the 5 remaining errors are not going to show in the next submission. It will only show the fixes in the second submission, since the record with the errors were already in the platform. And again, this is the purpose of that harvest summary report that Jeanette talked about. You would be able to have all of your errors in that one harvest summary over multiple submissions, so you'll be able to have them under one report in one place to see everything. So I don't know, Jeanette, if you wanted to add anything on that.
No, I think you described it perfectly.
Okay. All right. Our next question, what day will the surgeons receive their usernames and passwords? Will they receive an email with links and education on how to use the website in this email? So surgeons, correct me if I'm wrong, but surgeons will receive their usernames and passwords the same day as everyone else once the usernames and passwords are sent out. Is that correct?
Yes,
Melanie?
that is correct. Mm-hmm.
Okay, yep, just make sure I was understanding. And there will be education out on the STS website for surgeons and data managers and how to use the platform as well. So, and that is out there out on the STS website. What is the link I should send to our surgeons to get usernames and passwords? Again, Nancy, if your surgeons are currently, any surgeons currently listed on your contract as your surgeon rep or participating surgeons, they will receive their usernames and passwords. If you have anyone that is not currently on your contract that needs access, you would need to fill out the participant contact form and get them added and get them get that submitted, and then we could get access for any of your surgeons. If you have questions about user access, just please email stsdb@sts.org. Our next question, will you send an email with the user call-in info? Yes, there will be an email that comes out with the user call-in info for the user group call, as well as it will be posted out on the STS website as well.
Yep, and maybe maybe this would, Leanne, this is Carol, maybe this would be a good time if Jane's available to provide some information about the secondary emails.
Yes, ma'am.
Jane, are you there?
Is Jane
Jane is
on?
available. Thanks, Carol.
Thank you, Jane. Sorry.
Just a quick, oh, no, not at all. Just a quick announcement. This is something that we shared with the adult cardiac and thoracic data managers as well. We know historically there have been some issues for several of you, or some of you who whose institutions are either blocking emails from STSDB or STS headquarters. So as a workaround for that, we are now beginning to, or we've begun accepting personal emails as your secondary email that we can add to our database. And going forward for all email blasts, what we'll be doing is pulling both the primary email, which likely is your institution email, your hospital email address, and the secondary email, which is whatever you decide to add as your secondary email, so that we can send these email blasts to both of them in the hopes that you would receive it some way. So if you're interested in listing your personal email address as your secondary, please feel free to email the STS database inbox at stsdb@sts.org, and we'll be sure to update your contact record accordingly.
Thank you, Jane. I know it's actually a little bit after the hour, so we still have several questions left in the Q&A. I don't think we'll be able to get through all these right today, but just please know if we don't get to your question, please feel free to email me your question if necessary, and I'll happy to follow up and get an answer for you. Our last question I wanted to go over was regarding AQO and a price. And hospitals have been impacted financially by COVID. Budgets for education have been slashed. Have you considered the fee for AQO so that all data managers may be educated?
This is
And
Donna.
I know STS. Oh, go ahead, Donna.
I can take that one. We have to cover our costs. So for the platform to host the AQO and the CEUs, so it certainly won't be anywhere near the price you paid for the live offering, because we're not renting space or providing meals or anything like that. So we're very mindful of the economic crisis at hospitals and across the country right now, and will not make the price crazy or anywhere near what it was before, but I can't even give you a ballpark until the costs come in on our platform. But thank you for asking.
Thank you, Donna. I have about 5 after. I know I want to be respectful of everyone's time, as I'm sure people have other meetings and things to get to today. There are a few questions left here in the Q&A. Again, if I did not get to your question, please feel free to email me directly. I'm happy to answer any question that you may have from today's webinar. Just real quick, Kelly wanted to repeat the email to add personal email to your contact information here at the STS. And again, Kelly, it's stsdb@sts.org to add the secondary email. And Carol did just add that to the chat box. So again, I just wanted to thank everyone for joining the May webinar. I hope everyone has a great weekend. And again, if you have questions that were unable to get answered today, please feel free to email me directly and I will get a response to you. So again, thank you everyone for joining, and thank you STS staff and IQVIA staff for assisting in the webinar today. I appreciate everyone, and I hope you all have a great weekend. Thanks everyone. Look forward to talking with you next month.